My name is Lisa Greenwald, and I'm a family nurse practitioner at Schuylerville Family Health, which is a service of Saratoga Hospital.
Action.
What I'm finding with looking patients up is that we have a fair number of elderly patients who are seeing several other providers, specialists, and we don't necessarily always have the ability to know who those providers and specialists are and what medications they've been given. So it's a great advantage to be able to see that prior to the patient actually having a face-to-face encounter with me.
Okay. Action.
I've been using Hixney in order to kind of follow up on our patients that are on chronic narcotics and chronic controlled substances. What we're finding is that some patients are extremely good with taking the medications as prescribed and not coming to other providers. However, we have those patients, and Hixney has allowed us to identify them.
Thank you. Action.
Hixney has allowed our nurses to save a great deal of time in that patients normally call here for prescriptions and the chart has to go through the doctor, then to the nurse to call the pharmacy, and at this point I'm able to get that request and fill the request myself without having to bother the nurses, which frees them up to have a lot more patient encounter time.
Action.
I use Hixney for patient safety when patients are seeing multiple providers and getting new medications ordered by those providers. We've had problems in the past prior to instituting the Hixney with patients that have been ordered medications and we're unaware of it, and potentially we're prescribing other medications that may interact.
Action.
We had a patient come in last week who was apparently seeing two separate providers for duplicate medication. And without the Hixney system, I would have been able to identify that. So when she came in, I was able to access the portal, look her up, and realize that she was getting the same prescription from not one but two primary care providers. So that enabled us to confront that situation right up front and make the decision that we were no longer going to prescribe that because of fear of overdose.
Action.
I think for providers not yet participating in Hixney, one of the key pieces that you need to realize is that there is a fairly significant learning curve. It does take a little longer initially to get used to the system, so patience would be definitely a virtue. We are, however, getting a little more comfortable with the system, understanding what's required to write a prescription, to look a patient up, and things are moving much faster, much easier, and the learning curve is better now.
Action.
So I'm Ben Tonneau. I'm a physician with Capital Care. I'm an internist in Schenectady.
Action.
In different ways. I mainly use it to access the hospital records. For example, I had a patient.
Action.
I use Hixney to access the records for the patients. For example, today I saw a patient who was in a hospital at Sunnyview, and I use Hixney to access the records from Sunnyview, look at the discharge summary, look at blood test results, x-ray reports. If I didn't have Hixney, I would have spent it probably 10-15 minutes, probably not myself, but the staff, calling the hospital, getting the discharge summary, getting a copy from the x-rays, getting a copy from the lab results. And this additionally this was an older patient, and a lot of old patients don't really have their medications listed with them, so it's extremely helpful in that sense. Do I use it every day? Probably once a day at least. We have our own electronic record system, so I do not use it for prescription. So it's mainly to access information from other facilities. As I said, Sunnyview, Ellis Hospital. We get blood test results from other hospitals too. It's very easy to get in. Actually, I timed it today. And with an iPhone, which is not easy, accessing something from an iPhone, it was about 1 minute and 23 seconds. On an iPad, 43 seconds, PC, 45 seconds, about the same. When I have to go into the Ellis Hospital website, I also time myself. It's about 6 minutes to get the same information. So it's much faster.
Action.
When I access IXNI, speed, is very important. When I access the hospitals, usually there's not a lot of speed. In addition, when I access the hospitals, I have to have different passwords for different places, and it's time consuming and it's a pain in the neck. Having only one portal to access all the information obviously saves a lot of time. And it's not just for myself, but when the staff can access the information, it also saves time, for the staff.
Action.
Having all the data available very quickly through IXNI is very important. Sometimes if I don't have a discharge summary that's available within the next few minutes, the patient is going to wait. The staff is going to have to do a lot of phone calls. I may not be able to make the right decision because I don't have enough time. And as you know, physicians right now, we are very pressed on time. So speed is very, very important for us. Speed is the essence of all what we do. The discharge summaries are extremely important. Having the X-ray report are important, as well as the lab results. And also the accurate list of medications. More than once the patients are sent home and they don't really know what they're supposed to take. And having the right information from the IXNI portal helps tremendously.
Action.
When we use IXNI, we reduce the risk. What I mean by risk is a lot of time the patients take a lot of medications. There is a risk of drug interaction, and if I don't know exactly what they are taking, I can prescribe something that could be potentially risky. Actually, I remember a patient recently who was discharged, and he was put on a new medications for his cholesterol. He went home and he took that medication in addition to his previous cholesterol medication. Now with IXNI, the risk is gone, because as soon as he comes to the office, I can tell him right away, please do not take that medicine. I know exactly what you were discharged on, and I know what you're supposed to take. So it helps avoid potential major errors and mistakes.
Action.
My advice is that the system is very good as it is. It's going to save them time to access information from hospitals or other providers like us, Capital Care. We have about, I think our group has around 100,000 patients in the electronic medical record system. So if the specialists could access that information, that would save them, for example, a lot of time. Let's say a cardiologist sees a patient, the patient has high cholesterol, he can access the record very quickly and see what was the last cholesterol profile. That avoids unnecessary blood work. The system will get better as time goes on, and once all of us are on board, specialists, internists, family practitioners, pediatricians, you name it, all the different specialists, it's going to be perfect.
Action.
The data that I'm accessing through IXNI is mainly discharge summaries from the hospitals, rehabilitation centers such as Sunnyview, imaging reports, for example, chest x-rays, CT scan reports, MRI reports, blood test results, medications list, new allergies if the patient was hospitalized and new allergies were discovered,